Welcome everyone. So now we are going to discuss birth asphyxia. As the word indicates, birth asphyxia means asphyxiated or failure to initiate respiration at the time of birth. When baby fails to initiate breathe at time of birth, that is known as birth asphyxia. Now this condition is inability or failure to initiate sustained spontaneous regular respiration with varying degree of hypoxia. Now when there is failure of respiration, so baby develops hypoxia, and after that hypoxia there is ischemic injury to the tissues like brain and lungs. Damage can happen. So when brain is damaged, baby, there are a lot of complications develop because of decreased oxygen supply to the brain. When baby is delivered, there is decreased oxygen supply because of birth asphyxia and organ damage occurs. So it is known as birth asphyxia. Most commonly baby becomes blue during birth asphyxia, that is known as blue asphyxia, and infant become blue, and a muscle tone is good and infant is responsive to stimuli. But there is another type, that is asphyxia pallida, in which white or pale asphyxia, which is severe or more dangerous, in which baby become pale, flaccid and unresponsive to stimuli. In this way baby develops birth asphyxia. Now it is also known as perinatal asphyxia and defined as hypoxic insult to the fetus because there is decreased oxygen supply, which results metabolic acidosis, accumulation of lactic acid, and neonatal encephalopathy occurs, and multi-organ systemic dysfunction occurs because oxygen is decreased in that baby. Now definition of birth asphyxia, as we know that it is inability to initiate respiration at time of birth, and it requires resuscitation. This disease birth asphyxia requires resuscitation. Baby is given resuscitation, and after that baby is treated accordingly. Asphyxia means decrease oxygen, hypoxia, and hypercarbemia. Carbia means increase carbon dioxide, and acidosis because lactic acid accumulation occurs and baby develops acidosis in oxygen compromised baby. Placental blood flow is compromised, which may lead to birth asphyxia, and baby develops hypoxia. Clinical features are acidemia, means there is acidic blood, lactic acid accumulated in the blood, that is known as acidemia, which leading to abnormal heart rate. Baby develops abnormal heart rate and abnormal rhythm of the heart. Baby become paler and baby becomes cyanosed. Blue color of baby occurs. Decreased tone of the muscles and reflexes are diminished in the baby because ischemic encephalopathy has taken place, and that encephalopathy leads to diminished reflexes and tones of the baby. So poor cry or absent cry may occur in the baby, and gasping or poor respiratory effort occurs. Hypotonia occurs. Hyporeflexia means decreased reflex. Meconium stained liquor. Ocular manifestation like fixed dilated pupil or nystagmus occurs in the baby. Stupor, and baby may go into coma. So in this way birth asphyxia presents in hospital. These clinical features occurs in the baby after birth asphyxia. And asphyxia neonatorum is respiratory failure when baby fails to develop respiration, and inadequate intake of oxygen causes baby to develop birth asphyxia after birth. And it is also known as neonatal asphyxia. And in neonatal asphyxia or birth asphyxia, baby should be resuscitated in order to initiate oxygen. Now resuscitation requires radiant warmer and oxygen source 100%. Aspiration source should be there. Aspiration tube of different size should be there. Ambu bag and mask ventilation should be there. Face mask, laryngoscope, and uniform diameter endotracheal tube. Drugs like dopamine, epinephrine, sodium bicarbonate, naloxone, and volume expanders should be present at the time of resuscitation. So these are basic requirements for the resuscitation in patients of birth asphyxia. These are basic needs and used to develop oxygen in the birth asphyxia baby. Now consequences of birth asphyxia: in initial response there is hypernia and hypertension, then primary apnea occurs, gasping, attempt to breathe, And a secondary apnea develops, baby may develop bradycardia and shock, diminished cerebral blood flow, which results into ischemic necrosis of the brain. Cerebral hemorrhage may occur. Hypoxic ischemic encephalopathy can be there, and there may be death of a baby can occur because there is sustained and long time asphyxia occurs in the baby. Now, pathophysiology of birth asphyxia is baby develops hypoxia, means decrease oxygen in the baby because of asphyxia, and then ischemic damage of the brain occurs, and generation of free radicals occurs in the baby, and reduced energy production, reduced ATP, which results into lactic acid accumulation. In aerobic oxygenation results into lactic acid accumulation that develops hypercarbemia and lactic acid accumulation, and glutamate is released, which results into different organ damage, cellular damage, edema in the affected mitochondrial functions occurs in the birth asphyxia patient. Now, investigation. What investigation we will perform in the birth asphyxia patient? We will look at the renal function. It will be abnormal because oxygen is decreased and renal tubules are damaged. Renal tract will be looked. Doppler assessment for renal vascularization is assessed in patients of birth asphyxia. Hypoxic ischemic encephalopathy is consequence of birth asphyxia. First of all, birth asphyxia occurs, and after that, patient develops hypoxic ischemic encephalopathy. As the word indicates, hypoxic means oxygen is decreased. Ischemic means there is decreased oxygen supply. Encephalopathy means brain is involved in patient. Neurological disease in which there is term or near term newborn baby develops hypoxic ischemic encephalopathy followed by perinatal asphyxia, means term or near term baby develops birth asphyxia, and then hypoxic ischemic encephalopathy occurs because oxygen supply is less to the brain. And asphyxia means stoppage of the pulse, stoppage of the oxygen, that is impairment gas exchange, which leads to asphyxiation, and baby develops different consequences. Now, how we manage the patient of birth asphyxia? For the management of the patient, first of all, a baby must be managed by electrolytes, and blood urea nitrogen and creatine should be correct in the baby because kidney is impaired, and IV salbutamol, IV calcium gluconate, sodium bicarbonate should be given through IV route. IV soluble insulin should be given to the baby, and dextrose infusion is mandatory in the baby of the birth asphyxia. Renal replacement therapy should also be assessed in the patient, and baby should be kept warm because asphyxiated baby may prone to lose heat, and baby should be given breastfeeding as soon as possible because baby may develop hypoxia, hypoglycemia, and examination of the baby for anomalies should be there. Hypothermia and general danger signs should be looked in the baby. Now, monitor the temperature of baby because hypothermia can happen. Perfusion should be there. Carbon dioxide saturation should be looked, and oxygen saturation should be maintained in the baby. Glucose must be given to the baby, and metabolic profile should be assessed whether baby has edema or seizure, so that treatment should be done. And record the resuscitation time, counsel the complication. Normal breath is initiated, body temperature should be maintained, and look at the cry of the baby because a lot of baby may develop different types of cry, and there may be complication occurs. And then after all of these assessment, a baby must be discharged when everything becomes normal. So ventilation should be given to the hypoxic or hypercapnic baby, and maintain cerebral perfusion with correction of the hypoglycemia and hypocalcemia. Temperature should be maintained, it must be maintained, and control the seizure of baby with anticonvulsants like phenobarbital, and cardiac effect should be maintained by inotropes, and renal function should be maintained by dopamine. So in this way we can save the life of baby which has developed birth asphyxia, and we can treat the baby through these methods.